Go ahead.
Okay. Now we've cut away all the external muscle and skin tissue from the body cavity, from the visceral cavity, and I've exposed all the digestive glands as well as the heart. Let's start with the digestive gland. The first thing we see here, which is partly torn away, is the liver. You can see that structure here, and in cutting it away, part of this right here was damaged, so that's the liver, and the gallbladder hanging underneath it here. This is the liver and gallbladder here. Now when I move that out of the way, I actually can get in here and see this little sac right here. I'm going to lift the gonads up, and this little clear sac right here it's already busted is the swim bladder. All this right here was the swim bladder. You will damage it when you're trying to cut this away. It's invariably you'll do some damage to it, but all this is a swim bladder that I've cut away right here. Now when I move this out of the way, I can see my stomach and my pyloric ceca. This is my stomach here, and coming off of the stomach, you'll see these little finger-like projections. Let me get them out here where you can see them right here. These are the pyloric ceca coming off right here on either side. These little finger-like projections will be your pyloric ceca coming off of your stomach. That will come around, and this is the small intestines here. All this is small intestines. And then lying in amongst the small intestines, you'll see the pancreas. This is one of the glands that produces digestive enzymes to help in digestion. The small intestines will coil around on the inside, all through here, and empty into the large intestines back here. The large intestines will be back here. All this is the large intestines. Now I can see part of the spleen right here. You can see the spleen. And now this material here, which we haven't talked about in detail in the fish, but we will in the frog, this material is called mesentery. And mesentery is a thin film of material that helps hold the intestines inside the body cavity. We'll talk in detail about mesentery when we do the frog. And then of course we have let's see if we can find it back under here. Okay. Now then, again, there's part of the stomach and small intestines. Now let's go up here to the pericardial cavity where the heart lies. When we get inside the pericardial cavity, we see the heart located right here. Now back here, this sac, back here in the back, is the sinus venosus. This is returning blood from the two cardinal veins, anterior posterior cardinal veins, into the heart, and from the hepatic vein coming back from the liver. Empties into the sinus venosus. That will empty into this dark gray or dark brown structure up here, which is kind of soft. This will be the atrium. It will receive blood and store it until it can pass into the bottom chamber, which is the ventricle. Passes through that bicuspid valve into the ventricle. The ventricle is muscular. It contracts, forcing blood out through this bulbous arteriosus here. This little funnel-shaped structure will be my bulbous arteriosus. It will empty into this first artery here, which is the ventral aorta. The ventral aorta will then branch off into the afferent branchial arteries as they approach the gills. Now I'm going to try to pull this aside here so you can see the gills. And I'll show you, these are the gill filaments right here. This is where oxygen and carbon dioxide are exchanged. This hard cartilaginous area here is the gill arch. And then behind it, I'm going to lift these up and you can see the gill rakers. See all those teeth on there? That's the gill rakers. That's designed to help keep food out of the gills. So we have the gill rakers, the gill arch, and the gill filaments. Now the afferent branchioles and efferent branchioles are so small that they will not show up. We will not be able to see those. But the ones I want you to be concerned with will be the sinus venosus, the sac back here, the atrium, the ventricle, the bulbous arteriosus, and the ventral aorta. That's the most important things I want you to see up here in front. Okay?